Today, we are confirming that our government will lower the age of eligibility for self-referral screenings from 50 to 40 by December of 2026. We've previously already committed to lowering the age to 45 by the end of next year, and this is a really aggressive timeline to get to 40, but we know that this is an important timeline for women across this province. We have been working on this initiative in partnership with Cancer Care for many, many months. It involves staffing up mammographers, mammographer technologists in Manitoba, and adding more screening appointments so that we can help more women in our province access this essential care. Now, I want to be very clear. This is our government's response to the advocacy of breast cancer patients, survivors, women, and those across our province who have been impacted. We have been listening to their voices, we have been meeting with them, we've been meeting with you. And this step today is a direct result of all of your voices coming to the table, coming to our offices, coming to our communities, and your voices being heard. We've been working very hard behind the scenes on this, as I said, for many months. And I'm really proud to be able to share with you all today that this is happening. We want more women in our province to hear those 4 important words: you are cancer-free. And this work, these steps, is how we get to that reality for folks in our province. I'm happy now to take any questions on this exciting initiative and this important step that our government is taking. And I want to take a moment to thank all of the experts, all of the women, all of the advocates, all of the folks who have been working with our government so that we could get to this point today and share this really exciting news on breast cancer screening in Manitoba. Happy to take any questions. We've been working on this initiative for months. And I have to say that when I came into this role as the minister, I was pretty shocked because I was hearing right away from women in this province their concerns around breast cancer screening and their hopes that work was being done to address this and to build more capacity. I met with Cancer Care very early on, and they identified some challenges that they were having in terms of screening women and screening patients. And they made very clear that previously they didn't have the support from the former PC government in order to take the necessary steps to get more women access. And so, we announced several weeks ago now that we were lowering the screening age to 45. We made that announcement knowing full well that we've been doing this work for months to lower the breast screening age to 40. And I've said that actually many, many months ago in committee as well, that we're doing the work actually to lower the screening age. And that was only a matter of time before we were going out to Manitobans and sharing some more firm details. So I'm really happy that we're able to announce this today and share this news with Manitobans. And I want to express my gratitude for our partners who've been working with us for months to get to this point today. Well, a few weeks ago, we shared the really important step that we are taking to lower the age to 45 and the work that was going into that plan. And so we're taking a methodical, responsible approach in how we communicate this to Manitobans. We want to make sure that when we're sharing the information, it's digestible for folks. They have an understanding of the work that's going into that and what these steps will look like. And so a few weeks ago, we shared that we're lowering the breast screening age to 45 in 2025. And now we're taking that further step of making sure that Manitobans are well aware that we have a clear plan to lower the screening age to 40 as well. And then beyond today, there's going to be further news that we share with Manitobans in terms of how all of that comes together and additional steps that we're taking to build the capacity so that we can not only enhance this area of healthcare, but other areas of women's health as well.
How are you able to do this now? What changed in the last few weeks that's enabled you to make this announcement?
We've been doing, like I said, tireless work for months to make sure that we have an understanding of not only where we have to fill the holes that were dug by the previous government, like, they cut mobile breast cancer screening. They didn't bother to invest in training more mammographers to be able to provide this care and do the screening for Manitoba women. There are a number of areas that were not only cut, but just completely ignored and disregarded for years. And so what we've been doing very, very carefully over the past many months is understanding how we need to build capacity. We've been listening to women, working with women to understand how do we make sure that more women have access to the critical information they need to make the most informed decisions about their breast health. How do we work with our partners, not only Cancer Care, But we've been meeting with community organizations to see how we can work together to make sure we're reaching as many women as possible across our province and getting that information out in an accessible way. And so when we come out and share information like lowering the breast cancer screening age to 45, we share a host of information with that. We reach out to our partners to make sure that they can reach the women who need to hear this information. And today, when we share the news that we're lowering the breast screening age to 40, there's also a tremendous amount of work that goes into making sure that our partners, community organizations, and that folks across the province have access to that information. So there's a lot of work that goes into taking each of these steps, and there's much more work that will be happening as we move forward to make sure that it reaches as many people as possible. I'm sorry, can you repeat that? Mammography technologists, yes, I got you, yeah. We're going to need approximately 13 more mammography technologists in Manitoba to deliver this care as we lower the age to 45 and lower the age to 40. Now, something I think that is really exciting in Manitoba, our government recently shared that we've hired a net new 873 healthcare workers. That includes technologists. That includes the very folks, mammographers, who are going to be delivering this care. And what we're doing is something that was never done under the previous government. We're actually reaching out directly to those folks, working with our partners, making sure that they are well aware of the importance and the opportunity to get trained to be mammographers, and we're working with them to make sure we get more of these folks into the system and delivering care directly to women across this province. You know what, and I think that's a very fair question. To Manitobans who are asking why not do this faster, I want to reassure them we are working as fast and as hard as we can to make sure we can lower the breast screening age, build capacity, and get this care to women and those who need it across our province. Now, Manitoba would be much further ahead by now if we didn't have 7.5 years of a previous PC government that cut mobile breast cancer screening services, that closed the Mature Women's Health Center, that cut the services needed in order to build capacity in this area of healthcare, and that, quite frankly, didn't listen to women's voices in this province. Our government has taken a completely different approach. We listen to women's voices, we value women's healthcare, we invest in it, and we're working directly with women and experts across our province to build the capacity needed to successfully lower the breast screening age. Now, this is a different approach, and it's going to take us time to build that capacity, but we're working as hard and as fast as we can. And while other jurisdictions across Canada were doing the work to lower their screening ages, the previous PC government was cutting those services and was refusing to take steps in a better direction for women in this province. And that was the wrong approach, and our government is committed to doing better. Not at all. Not at all. We have been working for months on this issue. Our government has been meeting with Cancer Care, Dense Breast Canada, meeting with advocates across the province, meeting with scientists and experts, allied healthcare professionals, associations, post-secondary institutions, all working together to do the work to lower the breast screening age in Manitoba, to understand the impacts of the damage that was done by the previous government's cuts to women's health care, and to understand how we can work together to build the needed capacity so that women across this province can hear those 4 important words: you are cancer-free. And the approach our government is taking is to truly work in partnership and to listen to women's voices. And I can't say this enough. We would be in a different place, a better place in this area of healthcare in Manitoba if the previous government, while other jurisdictions in Canada were building capacity and taking steps to lower the screening age, the previous government was cutting services, cutting capacity, and not listening to the voices of women in regards to their health care. And so we're working as fast as we can. If we could make things move more quickly, we will absolutely do that. But this is a really aggressive timeline for Manitoba, given that we were starting in a deficit due to the previous government. But we're working as hard as we can because we know it's important for women across this province. Sure. Yeah. So the previous government cut mobile breast cancer screening in Manitoba multiple times when they were in office. Mobile breast cancer screening in Manitoba is one way that about 25% of women access breast cancer screening. A massive number of folks get their screening through that service, and that was cut multiple times by the PCs. They closed a renowned mature women's health center in Manitoba that was established by some of the foremost leaders in women's healthcare. This was a place where women could go, mature women who are eligible for breast cancer screening could go and get care, have their voices heard, their needs met, and have their breast health assessed by specialists. That service was cut under the previous government. We lost that capacity almost overnight in Manitoba. So there are real cuts and damage done to healthcare by the previous government that has contributed to the challenges that we see in terms of wait times for breast cancer screening, for diagnostics, that have contributed to challenges around making sure that we are able to retain and recruit and train folks in this area. But our government isn't allowing the mistakes of the previous government to be excuses for not acting now. We're taking real action because we're listening to women, and we're working with experts who also see this as being a priority, and we're making progress, which I think is really important to note. We have a net new number of healthcare professionals. That includes allied healthcare workers. That includes the very technologists who deliver this mammography care to women in our province, and we're going to keep doing that work. Okay, thanks everybody.